Hi, everyone. I'm Daphne here at the Sync team with another interview, bringing you insights into metabolic health and all its different facets and what you can do to live healthier and a longer life. Today, we're looking at childhood obesity, and we're also going to delve into the topic of carbs a little later, which I know a lot of you are interested in. And I'm delighted to say that I'm joined by Eleni Kui today. She's a pediatric dietitian. She has a degree in nutrition from King's College London and the University of Bristol. She's worked as a clinical dietitian for 8 years in university hospitals such as Hammersmith Hospital and University College London Hospital. And she specializes in pediatric diabetes. And her main sort of workload has included cases of children with food allergies, obesity, early puberty, or insufficient growth. And she's also a member of the British Dietetic Association and the British Pediatric Dietitian Group. Eleni, thank you so much for joining me. Welcome.
Thank you for inviting me, Daphne.
Great. I'd like to talk about the topic of obesity first, and particularly childhood obesity, which I know is one of your areas of expertise. And I'm talking here about children and adolescents aged, 2 to 19 years old. Um, I was reading earlier that the prevalence of obesity in children is around 18.5% worldwide. It affects around 13.7 million children. But today, I kind of want to go beyond the numbers and delve into the causes and what parents or children can do to both prevent themselves from developing obesity, but also some practical tips and strategies for managing it too. So, first off, I guess I just wanted to ask, what is obesity, and is it the same in children as it is with adults? Just give us a super quick overview.
Sure, Daphne. When we talk about obese or overweight children or adolescents, we need, first of all, a proper measurement of the anthropometrics, weight and height being the basic ones. That's why it's very important for each separate individual kid to assess weight and height and see whether that kid carries more weight for their height or less weight for their height in some cases we assess weight and height in curves. It's not just a measurement that we write down in a piece of paper. We need to properly plot them in graphs, assess them against their age at any specific age. And then also, we calculate BMI, body mass index, for both children and adolescents. And we also use appropriate graphs or growth curves, as we call them, again, up until the age of 18 years old.
So, what does it mean in practical terms? What are the physical manifestations? I mean, beyond the actual sort of physical appearance of someone who I guess is overweight or obese, and the BMI, as you mentioned. What about things like abnormal kind of excessive fat and fat accumulation and the problems I guess that this can cause, because it's more than just the number of your BMI, right? It's an actual condition that presents several health risks when you're diagnosed as actually being obese.
Sure. I would say that when we think about obese children, we need to think of future. It's not. We need to think. We need to think we're talking about future obese adults. We very often say it's not going to resolve by itself. We need to take care and treat, or even prevent childhood obesity in most cases. So I would say childhood obesity is even more severe than obesity in adulthood, because it will definitely lead to future health problems in later adolescent or adult life. Unfortunately, these days we see health problem or consequences of obesity that we used to only see in adults about 20 years ago. So we talk about kids with insulin resistance. We talk about kids with respiratory problems, with sleep apneas, sometimes like problems with difficulty with breathing during their sleep during nighttime. Um, some of the initial signs that even the kids themselves realize is difficulty moving or not being able to follow physical activities or PE classes at school. They feel like their knees or backs hurt. They get breathless more often. So really, obesity will affect not only growth and development and everyday routines, but also future health of our kids. Not to mention that obesity and body shape, body image situations will have an impact in, their mental health or the relations with other kids their age, or friends as they grow up.
Yeah, so important. And I mean, you mentioned insulin resistance there, and correct me if I'm wrong, but I was reading that, children, as adults as well, who have obesity are at a higher risk of also developing things like type 2 diabetes. Is insulin, our insulin levels, and to extent, regulating our blood sugar, making sure it's balanced, keeping our insulin in check, is that really important when it comes to managing childhood obesity?
That's also very important. I would say when I was when I was a student at King's, we didn't used to talk about type 2 diabetes in kids and adolescents, but it's actually becoming everyday practice at the moment. Yes, there is a huge risk of developing type 2 diabetes even in adolescent stages. And the other thing that affects that obesity or overweight affects their growth of development. We need to mention and make it clear that if I have a child pre-pubertal ages, if I have a child, girl or boy, that carries more weight that they can actually afford for their height, that extra weight, that extra body fat accumulation will trigger puberty process earlier than we want to. And that's a problem because um, we face the risk of that kid never achieving the optimal height that they would have achieved if they carried a better relation of weight and height weight to their height. And also with our girls, we see puberty starting much earlier than we used to a few years ago. That's a problem that affects both their optimal, as I said, final height that child can achieve up to the age, depending on the genetics, but up to the age of about 16, between 16 to 18 years old, but also more body fat accumulation. That especially with women, with girls, the moment they go into puberty with that extra fat accumulation, it's becoming even more difficult to get rid of that fat in later life. So really, we have kids that they get programmed to carry extra weight and fat if we don't intervene and if we don't help them on time for the rest of their lives.
Really interesting. Before we go into some of the specific strategies that you'd recommend that maybe parents listening to this could try, what is the overall sort of goal that we should be aiming towards when it comes to both preventing but also managing obesity? What's kind of the overarching goal? Is it balanced blood sugar? Is it keeping insulin in check? How should we be thinking about it?
I would say, first of all, keep our health checks regular, either with our pediatricians or a pediatric endocrine doctor is the most appropriate, suitable health professional to initially assess the overall health, including blood sugar levels and you know, probable insulin resistance or overproduction with regular blood tests. That's one thing. The other thing is to be honest and be aware. I very often say if there's a family history of type 2 diabetes or obesity, we need to keep an eye, a closer eye to what the kid is consuming, what sort of dietary habits are developing, and make it as part of child's education to actually develop better, healthier lifestyles. The other thing is that there's technology these days. Offers us lots of tools, more opportunities to actually either monitor blood sugars or monitor dietary habits, monitor, report those habits and results, and actually go with those results and data to our doctors, our pediatric dietitians, and actually helping them with ready data to interpret and put together a plan which is more individualized, and more sort of um, matched to their family needs or the child's needs.
Definitely. So when you talk about those habits and lifestyle, I mean, diet is presumably a really big one, right? What should we be keeping in mind? What should children be avoiding or getting more of? What are your top thoughts on that?
Sure. When we talk about practical advice, because I hope we have families and parents listening to us today, I would start with suggesting having an organized meal routine during the day. Half of the times, this is enough to actually prevent high blood sugar fluctuations during the day, organize better sort of satiety, food portions, and cravings, avoid cravings. During the day. So, first of all, we need to sit down and have a plan, even with specific times, if needed, of when that kid needs to be consuming food. And then we need to have a conversation with the family.
Is that sort of to avoid things like overeating? Sorry to interrupt you.
Exactly. And then we need to make sure that I mean, I take the time to explain that every meal during the day um, doesn't have the same importance. And what I mean by that is that I meet families that are very fixated in terms of the number of the meals they need to be consuming during the day. Some families, they come to me and they say they need to be four, they need to be five, or, do we have to consume 6 meals a day? But we don't have the time for those 6 meals. And I say, there isn't a magical number of meals during the day that will improve your kids' health, nutrition, and overall growth. I explained that we have three main meals, that they sort of form the backbone of that kid's diet, and that's breakfast, lunch, and dinner. And any opportunities over the 3 hour interval, so to make it more clear, every 2.5 to 3 hours, sorry, if there is an interval between those main meals, we need to think about snacks, but healthy snacks that they are there to actually um, meet extra needs of that kid in terms of nutrients such as calcium, iron, dietary fiber, and vitamins. Snacks are not there to actually um, spike our blood sugars or create more cravings for the rest of the day. So when we talk about snacks, whenever they're necessary, we talk about.
Does that mean selecting foods that don't spike our blood sugar? So what kind of foods do we mean here?
Ideally, in my mind, snacks are there to actually keep our blood sugars stable between main meals, not to actually spike blood sugars in between meals. So anything with low glycemic index fruits or combination of fruit and good fats from nuts, for example, like peanut butter or tahini sesame paste that we have here in Greece, or any combination of nuts, for example, with our fruits, anything that will will keep blood sugars stable by actually giving a little bit of carbohydrates. We'll talk about that later, but not letting that carbohydrate quantity um, cause a high blood sugar. So snacks are there to actually maintain blood sugar levels and give extra calcium, iron, nutrients to the that kid that is actually growing. One extra comment I want to make about snacking, Daphne, is for older kids in adolescent years. If they don't ask for snacks, don't offer them. There's this principle that we follow mostly with adults when it comes to controlling those blood sugar fluctuations or weight overall. If you're not hungry, you don't have to eat in between the main meals. And sometimes I use a principle for adolescents as well. If they don't feel the need, if they don't feel that craving or need to snack on something, especially later in the day, uh, I wouldn't ask the adolescent to actually go and eat something before dinner.
I think that's so important because I think the dogma for so many years has been that, we should have lots of small snacks throughout the day, shouldn't sit on an empty stomach because it might not be good, might slow down our metabolism and all these things. So I think it's great to kind of, I guess, bust that myth in a way, because you're saying that that sort of promotes unwanted and unneeded, really, glucose fluctuations, which, as you said earlier, can do things like increase our cravings, things like that.
I would say that the other thing that we want to avoid by avoiding spikes in our blood sugars has to do with concentration, and it's very and academic scores or overall behavior. And when it comes to children, adolescents, I think it's very important. We can't expect an adolescent or a younger child to actually be able to focus, be well behaved, or um, what's the word? Bring back good grades in exams. When blood sugars are all over the place. And diet definitely plays a role in those situations. I very often discuss this with families that they need, for some reason, to control blood sugars before exams, and planning the meals the days before the exams or during the day of the exam is very important for those kids.
I know, I was just about to say that you reminded me that when I was younger, I always remember my dad used to tell me, "Don't have," a lot of the kids around me would have, let's say, a chocolate bar or something sweet before the exam to sort of give them energy. And my dad would always say, "Don't have chocolate because you'll go up on a high for, let's say, the first half an hour or whatever. But these are exams that, might be 2 hours long, even an hour and a half long. Have something that will give you sustained energy and won't make you peak and then crash." Yeah, unfortunately, I always wanted the chocolate, but I did learn to listen to him at some point.
Yeah, it was well said, coming from your dad. Now, the other thing I would say in terms of the practical advice for parents, having a good breakfast can make a huge difference. Starting off our day with, I would say, a portion of calcium for the kids that they definitely needed to um, um, support the bone health. So a portion of calcium paired with a source of good carbohydrate, and we'll explain that in a minute, will definitely start off the day in a better way. There's a golden rule. I very often say that to the kids I work with in terms of the breakfast meal. We avoid anything sweet, even if it's homemade, because sometimes moms are very proud of the cake or the cookies they made. But I'd say we avoid anything sugary, even homemade cookies, cakes, or confectionery, and anything that comes in liquid form, even freshly squeezed orange juice or smoothies. The reason for that, Daphne, is because everybody, all of us, have a slight built in insulin resistance the early hours of the day. The insulin resistance becomes more prominent during the adolescent years, and especially important for our girls during the adolescent years. So it's an excellent sort of tip, I'd say. It will start off the day much better, and it will make it easier to control the blood sugar fluctuations for the rest of the day. If you start off your day, let's say you start off your day with a nice fasting blood glucose value, and then you start your day with chocolate milk, or milk and some a piece of cake, or a pancake with chocolate spread, for example. That nice fasting blood sugar level you woke up with, it will spike, it will go very high, then it will just crash very quickly very low, and that fluctuations will follow you for the rest of the day.
What you said was really interesting, and I just made a note of a couple of things that I wanted to ask you. I mean, I thought what you said about insulin resistance, having a kind of inbuilt, slightly higher insulin resistance earlier in the day, is that something that we carry on into our adult lives as well? I mean, I've seen it definitely when I'm wearing my continuous glucose monitor, my CGM. If I don't eat the right kind of breakfast, it does feel like it can more easily bounce around and kind of get off the optimal levels than if I was to maybe eat the same thing slightly later in the day. I mean, how is that explained?
Uh, that's a characteristic, that's physiology for us. We can't really manipulate that, but we need to make sure that we know of it. We are aware of the sort of phenomenon during the early hours of the day, and especially for female metabolism, the insulin resistance definitely becomes more prominent during adolescent years and during pregnancy. So even for women, that's why I said even for our girls in puberty, is more important for them to know and take care of that characteristic.
Definitely. And also what you said about fruits and I guess juice as well, because that's something that, again, I only found out recently. I mean, I still remember my mum almost every day would make me, a big, glass of freshly squeezed orange juice. And then lo and behold, when I when I tried it out wearing this continuous glucose monitor, I see that it spikes me more than if I'm having, a couple of biscuits with sugar in them. Um, I think it's also I mean, you'll explain a bit better, but it's also because we're having it the pure juice without the fiber in it, which, obviously means faster absorption as well, right?
Sure, that's spot on. Now, what we need to avoid, it's not the fruit. If you decide to eat your whole fruit for part of your breakfast, is absolutely fine, and that can be a good choice paired with a little bit of carbohydrate and probably your calcium coming from your milk or yogurt. But it's the liquid form of fructose. Fructose is the natural sugar occurring in our fruits. We like fructose, but when it comes to the liquid form of fructose, especially in the early hours, it can actually, if you monitor your blood sugars in a continuous monitoring system, it's just amazing. Within the first half an hour, that blood sugar levels will go sky high, and that happens to everybody. Now, when you squeeze your orange, you lose your fiber, you lose your dietary fiber, is the element in our fruit that actually makes fructose, the sugar, to get absorbed more slowly. And that's why we say we eat our fruits and we don't drink them. That's the motto I usually use for kids. You want to eat your fruit and not to drink it, because when you drink it, then it won't satisfy you the same, and that has to do with the fluctuations in your blood sugars. The other thing, you mentioned quantity and how your mom used to prepare like a huge glass of juice for you. My mom used to do the same. But what we need in terms of consumption of orange juice or any fruit juice for our kids is maximum 120 to 150 mls of juice for that kid, and that equals to a portion of fruit for the day. Let me just add an extra tip note to the juice subject. According to the guidelines coming from the American Diabetes Association, uh, it's not necessary to offer any fruit juice to our kids younger than the age of 2 years old. So basically, in simple terms, you avoid fruit juices for kids younger than the age of 2. And when you start introducing, if you want to, then you start with quantities no more than 120 mils for the day.
And also, as we were talking, I was curious because you mentioned fasting glucose. Is it different, the ideal fasting glucose levels that children or adolescents should have versus adults, or is it the same for everyone? The kind of guidelines, let's say, for non-diabetic children.
Not much, to be honest. And I would say something here. Very often, parents come with lab results, blood results coming from all sorts of different sources, hospitals or private laboratories. And sometimes the range of the acceptable fasting blood sugar can be up to 120 milligrams per DL. That's the measurements here in Greece. Uh, but in real life, we don't want the fasting blood sugar level of our kids and adolescents to be much over the 90.
No, I was just going to say that just to summarize kind of what we've said, and move on to our next topic, which I'm really excited about, which is carbs. What are some of the main, and you'll tell me if we've left anything out in terms of what parents can be doing and what children can be doing, but what are some of the main worries or struggles or obstacles that you see and you hear from parents that you speak with of obese children?
In terms of the management of that kid,
Yeah, exactly. Like, maybe you've seen, people who have been struggling with it for a while, and what are the and then and what would you advise those people really if you had to say, let's say, three things, and what are the worries that they come to you with mainly?
I would say make home environment the one environment that you can control. Most of the times is the home environment, so make that one a healthier environment. Um, by removing all the all the what's the word, distractions, but I'm looking for another word. So it's not enough if you have your fruits and vegetables in your kitchen, if you have
Temptations, let's say,
temptations.
maybe.
Yes, that's the word I'm looking for. So it's not enough if you provide fruits and vegetables. Remove the cakes and the biscuits and all the sugary stuff at the same time. If your child is already overweight and or obese, that child has proved us that they can't control their appetite, or they can't control the way they consume things. So it's up to us, it's on our hands basically, to help the kid by um, presenting a better home environment. The other thing I would say to parents is they need to become the example. If they set the pace, the kids will follow. They don't need to make comments like, "Oh, I hate broccoli. I never have fish." The whole family need to change their habits so that kid will follow their lead. The other practical, and it works, we need to make the children part of the change. I'd say take the kids to the supermarket or the market with you, make it fun, ask them to choose a new fruit or a new vegetable that you will then incorporate to a dish or a new meal during the week. So let them explore new tastes and flavors with you. And even for the older ones, let them play in the kitchen and let them prepare something like a smoothie or a salad or a quick snack with you. Um, Most of the times, you'll be surprised if the kid was involved uh, in the preparation of a healthier meal, will definitely have the curiosity to try that new meal. So make it fun, consistent. I always say that one good day will not make a difference, but you want every day to be a little better, a little healthier than the previous one, and then at the end of the month you'll have a number of healthier days, and that can make a difference.
Great. Thank you so much. Very wise words.